Hi, my name is Patricia Martucci, and I'm a licensed marriage and family therapist practicing in New York, New Jersey, and virtually right now in California. I'm a humanistic transpersonal therapist, and I also do EMDR. I'm a somatic experiencing practitioner, also a registered yoga teacher and Reiki master. So, I wanted to do part two of a video that I recently did on spirituality integrated into therapy. And part of what I love to talk about as a therapist is being an open channel to receiving information that is coming, through a higher source as sitting with my clients to really be a channel for them and to, ask that I can see things and know things that can help me to support and guide and lead um, the clients that I'm seeing to the space that they want to be in and through different, more stressful moments in time. So, I had a fun story I wanted to share about something that was really beyond comprehension. That happened again as I was working at a treatment center for addiction in Malibu. This happened about 10 years ago, actually, by now, or actually, yeah, 10 or 11 years ago. So there, so I was seeing, actually, I believe it was probably two of my first clients. Maybe it was my second and third client that I received in this particular center while I was there. And it was the first center that I worked in that was a detox center all the way through residential for substance abuse and addiction. And it was definitely an experience to be on the front lines, meeting clients from the moment that they come in, supporting them through their detox, and then, being able to watch many of them really come back to life in the time that they were there. And it was a beautiful experience on so many levels to be able to do that work and just really hold space for clients as they were really trying to lean into a different experience for themselves. So, and it was a really wild experience for me being on the newer side of being a therapist, and I loved working there for so many reasons, and it was challenging as well for so many others. But there was this one moment where, I was working with these two clients, and living there, a lot of the clients would develop friendships and relationships with one another because they're going through this really intense and powerful experience together. And as somebody's healing from addiction, it really is asking of them to let go of their primary relationship with a substance and to really lean into the human relationships that of love and support that can help them to really, kind of know themselves and to meet their needs of love and support and whatever it is through human relationships rather than a substance. So I was in this treatment team with a group of colleagues, and I had this colleague of mine who was very spiritual and really tuned into her dreams and just lots of stuff going on. And she told me about a dream that she had of two of my clients. And the dream was that, and these were two girls that had come through and were really struggling, with severe heroin addiction. And, and I have a ton of empathy for that particular addiction just because of the detox process and also the post-acute withdrawal symptoms that continue to happen over time. And so, and how easy it is to give in to the pain and, kind of get that cycle going again, because who wants to feel pain, right? So I think in recovery, it's asking our clients and ourselves to have to, increase their distress tolerance to feel a bit of pain in the moment, or uncomfortability, to give them a better, bigger picture in the long run, which is a hard thing to do, because usually when we ask, for help, it's like, if I have strep throat and I go to the doctor, they're going to give me a medicine that's going to probably help heal what's going on pretty quickly. With an addiction, it really is asking and really developing a caring support system around a client so that they can gently release the cling of addiction, like the grasp of that the addiction has, which can be uncomfortable for sure, and to try to settle into a different place of being in the world and a different experience. So there was a lot of spirit intertwined into this work, and there still is. Whenever I work with people who have addictions, I really like to create a loving, supportive, caring, non-judgmental, nurturing environment that can feel that they feel like they can bring their truth in and their true self. There's a lot of shame, obviously, with addiction, because some of the behaviors that go along with getting the drug or the alcohol or whatever it is to feed that part of them. Sometimes there's different behaviors that they do that don't align with their values, and morals. And when someone has an addiction, that is the primary focus. Everything else is secondary. So just to set the scene a little bit to what it was like, working there was very emotional. We would have clients that would get better, and they would get better. We'd watch them detox, and they might go out or go back into the world, and we would see them a week later, a month later, having relapsed right away. If we were lucky, we would see them, and we've had some people who wouldn't make it back, and that was really sad. We would hear about that news as well sometimes. So this particular situation, there were 2 girl clients, and young women, wonderful, bright, beautiful women who had the cause of addiction on them. And when that's the case, it can really destroy and ruin beautiful, wonderful lives. And so my colleague and my friend had told me about a dream that she had with these 2 girls, and she saw them in the ocean. Like I said, we were in Malibu, and there was a beautiful ocean we had a view of, and that they were there and they were playing with the dolphins, and both had big smiles on their face, and were kind of living their best life. And at that moment in time, it didn't really seem like something that could have been in the realm of, I guess, the current situation, because it was really brutal on both of them to go through the detox. So I took that in, and I held it. And so time went on, and both of those girls graduated from the program, went out. One of them I actually never heard from, and I'm hoping that she's living her best life in the world. The other one I did continue to work with after the inpatient or residential treatment center that I was supporting her, and we saw each other on outpatient for a really long time. And and I was so grateful to be able to work with her and to be a part of her journey. And so I think this was probably about, let's say, 2 or 3 years later, we were working together, and it was such a blessing and gift to get to see her life open up and take shape and form after the horror that she had gone through. And there were definitely challenges on her path. And I remember, the feeling that I felt when, one time she came in and she had said that she was having a great time. She was in a relationship, and she was in, she actually had gotten together with the other client. They had remained in touch that I was working with, that I mentioned earlier. And she was telling me this story about how they were playing in the ocean, and they were sitting there, and these dolphins came by, and she was describing it. And I had this moment of like, wow, like, this is unbelievable, and I had already, had heard that story, and I heard it through a friend who had that vision, 3 years earlier, and how powerful that was. And I, kind of inquired personally to see if I wanted to share that story with my client, because I feel like when you go through addiction recovery, there's a huge spiritual component for many people. I don't know many people who can recover without, believing in something bigger than themselves that can help them and that they can plug into. That's, there to a source of good or a power of good. So, and she was really aligned with the serendipitous, qualities of the greater good. So I think I did tell her, and we both sort of got a bit emotional and got tears in our eyes, and it was just a miraculous full circle moment. And I wanted to share that because I feel like, if we as healers and therapists, can do our own work to stay open and to allow ourselves to be receptive to the channels that are here to help us in informing and guiding our work, I've experienced that there's a lot of force and energy that can help to carry us, and to give us, these moments that are really beyond, you know, beyond the human experience, that come from a place far beyond. So, and I think that's part of, for me, what being a transpersonal therapist is being open to those channels and being plugged in and attuned to the spirit. We say working with the body, the mind, and the spirit, and all the different channels that we have as human beings, is so important. And I used to get really frustrated when I was in my own therapy, starting out as a teenager, that didn't really last. And also, as a therapist in this field, when I would come across people who would be really just in their heads and more having a cerebral, experience in therapy, because I feel like that's so one-dimensional and it's not inclusive of all of who we are as people, and the experiences that we have here. So anyway, I hope you enjoyed the story, and there are many more to come, so sit tight and hope to see you soon.